right, George, I'm just going to lift you up a little bit, all right?
No, it's gonna hurt.
Just do it in 2 stages. You can go from there.
Ow.
Just catch your breath. And we're going to go a tiny bit more.
Ah.
That's going to help your breathing a little bit. It's going to let your tummy hang away from your chest. Now, George, to help your chest get better, I'm going to put my hands on your chest and we're going to do some breathing exercises. I'm also going to do some little vibrations, and I'm going to do it on your arm first. You're going to feel like some shakes like this. Can you feel that, George?
Yes.
So I'm going to be doing that on your chest to help move the phlegm that's in there. All right, sitting you up is going to help get a little bit more air in there. And then this is called a vibration. I'm going to try and vibrate into your chest to try and move the secretions. And then we're going to do some coughs to try and get it out. Does that sound okay?
Okay.
Great. All right, so first of all, I want you to just breathe in nice and deeply, George. And with each breath in, I'm going to do a little bit of a stretch down like that, okay? Is that comfortable?
Yeah, it doesn't hurt.
Now I'm going to bring the vibrations in, George. So breathing in and all the way out. And you feel that? Feels a bit shaky, doesn't it?
Yeah.
Breathing in and all the way out. Breathing in, nice big stretches, and all the way out. Okay, take a little break now, just back to normal breathing. I'm just going to put a mask on, George, so that when we can do a cough, okay?
Okay.
Okay. Now, George, I want you to breathe in really, really deep. Feel the big stretch with my hands. Hold your breath. 1, 2, and out. Big shake. Okay, and again, George, breathing in all the way in. Big, 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 big. 1, 2, and all the way out. And again, George, breathing in. Really, really deep. 1, 2, and all the way out. We're going to do 2 more of those, George. Breathing in, all the way. 1, 2, hold your breath, and out. And 1 more, George. Breathing in, hold your breath. 1, 2, and all the way out. Great work. So George, the first thing I'm going to do before we do your coughs is I'm just going to lay the bed down a little bit. It's just going to help your cough be a little bit more effective. So about 30 degrees. That's right. Okay, and now I'm going to give you a rolled towel, which I'm going to get you to use to support your wound, like so. And then we're going to do some coughs together. I want you to take a really deep breath in, George. I'm going to place my hands here. And do a deep breath in, breathe all the way in, and cough. That's good. And again, George, I want you to breathe in, all the way in, and cough. And breathe all the way in and cough. Good. Okay, George, now I'm going to suction that out of your mouth. Okay, open wide, George. I'm just going to use the suction. That's right, all the way. Good work. Yeah, we got quite a large amount of secretions from there. Good. Excellent, George. That should feel a little bit better.
It does.
Great. Does it feel like the phlegm's not so stuck now?
Yeah, I think we got it.
That's great. I'm just going to have a bit of a feel of your breathing. Good. There's start to be a little bit of movement on that side now. Great. Okay, George. So we've finished your physio for now, but I'm going to come back in about 3 or 4 hours and see you again. And I want you to be in this upright position for the next half an hour or as long as you can tolerate, okay? Does that sound all right?
Okay.
Okay, I think the nurse is coming back now. Hi.
Hey, how'd you go?
Good. Look, we've just finished, and George was quite productive of a large amount of thick secretions we're able to get using the Yanker suction from his mouth. So I've sat him right up like this just to try and optimise his ventilation.
Yep.
He probably will need to really keep on top of that pain relief too, though. His tummy is a bit sore, and he's not going to breathe very deeply or be able to cough very easily if his pain relief is not really under control.
Right, I'll make sure he gets plenty.
Yeah, and if he could sit up like this for sort of the next half an hour to an hour, that would be great.
Yeah.
The other position that you could put him in would be right side lying, if he can tolerate it in terms of pain-wise.
Yeah.
And I would also encourage his mum to be involved with his coughing and do the assisted coughs.
Okay.
I've taught him how to support his wound here using the towel. But his mum will be able to do that support on his chest just to help make his cough a little bit more effective.
Yeah, no problem. I'll let her know when she comes back.
Right, so I'll come back in 4 hours if that's okay with you.
Yeah.
Just around your feeds, that works.
Mm-hmm.
And I'll see you then.
Brilliant, thank you.
Thanks.
Alright, George, let's have some more medicine.